Hey guys, this is Dr. John Ejizeri coming to you from San Clemente, California. And in today's video, guys, we're going to be treatment planning a failed 4-unit bridge. And I'm going to explain to you guys what are your options if a scenario like this happens to you and your mouth. Okay, let's get our story started with what happened to our patient. Patient presents to us and he had this bridge placed by another dentist on his front 4 teeth. So he's missing this tooth, number 8, and this tooth, number 9. And the dentist elected to put a bridge on teeth number 7 and 10. I just brushed my teeth, so my teeth are clean, guys, okay? And this is what the bridge looked like. That's the back tooth, that's the front tooth. As you can see, you have root canals, you have a beautiful post, and you have a pretty good looking bridge. But here's the problem. The bridge is only 4 years old, and it was starting to move and wobble. So the patient comes to us and tells me, doctor, my bridge, which I did somewhere else, is starting to shake. What do I do? Well, I looked at his x-rays and assessed it, and you can kind of see the separation of the bridge from the tooth. So I didn't have a good feeling. This didn't look like a bridge that's getting loose. It looks like a bridge that's just about to crack and break off of the teeth and leave those 2 additional supporting teeth in pretty darn bad shape. So I told the patient, look, just go chew some gum, let's just see what happens, and let's wait for it to get loose where it falls out, and I just glue it back in, an easy 5-minute procedure, or for your teeth to break, because there's really nothing I can do, especially since I didn't do his initial bridge. I was not about to get in the middle of a messy situation knowing exactly what's gonna happen. So I explained that to the patient, told him to just be careful and whatnot. Patient goes, and of course, a month later, I get a phone call that, guess what, doctor, my bridge broke like you had told me it probably would. And this is what the patient looked like once he came back to us with the broken bridge. That's tooth number 10. It broke pretty much at the gum line. You can see the root canal and post, but the entire supporting tooth structure, gone. And this is the opposite side, okay? So the same exact thing, they're almost identical. You can't even tell which tooth is which, right? But long story short, 4-unit bridge, and it broke in a couple years. Okay, this is what the panoramic would look like for those of you who are into panoramics. And I did an illustration to show where the broken root tips are. So this is the broken root number 7 and a broken tooth number 10, which is, again, back to our actual x-ray, number 7, number 10. So what do, guys? What are your options if a disaster like this happens to you, right? You just got done spending thousands of dollars getting root canals, getting a 4-unit bridge. Couple years later, it's all broken. Why is that? Why did this bridge break? And what are your options? What can this patient do going forward so that he doesn't have to worry about a failed work? Now, obviously, he doesn't want to go back to the dentist who did this to him. So he comes to me like all these other people do. But what are his options? So here's what's going to happen, guys. We're going to go over each option in this video. I'm going to break it down, explain to you the pros and cons of each option so you guys have a clear understanding of what you should do so you avoid disastrous situations like this, because it sucks to do a root canal, do a bridge, have it fail a couple years later. You spend all this time and money and now you have nothing to show for it, and you started with 2 missing teeth, right, number 8 and 9. Now you have 4 missing teeth, number 7 and 10, because the way those teeth broke, there's really nothing you can do to just salvage them like that. Okay, so what are the options we're going to be discussing in this video? Well, here they are. We're going to go over option of a new bridge, a 6-unit bridge that's adding the additional teeth on the side. So that's option number 1. Then we're going to go over the discussion of the option of putting a partial there, a removable partial to replace the front missing teeth, as well as the bridge that's about to fail. So I'll go over the pros and cons of that treatment. Afterwards, I'm going to go over dental implants, so how you would go about putting implants in that region if you decide to go that route. And then last but not least, one of the most popular options, all-on-4. How we would go about putting an all-on-4 so we don't have this problem. So there's 4 different options I'm going to discuss. Guys, get yourself ready because I got a lot of things to go over. And along our journey, we're going to bring the toilet of wasted dental dollars. There you go. There's that. Toilet is going to help us avoid wasting money. Okay, and we're going to start using the toilet right away, because here's what happens, guys. If you have just your front 2 teeth missing, right, and you decide to put a 4-unit bridge on these 2 teeth, there's a lot of things you need to watch out for, okay? Number 1, the lateral incisors. Okay, I'm going to draw your attention to my model here. This is the lateral incisor. It has a very tiny root. It's one of the weakest teeth. In fact, it's the weakest tooth on the top are these 2 teeth. So using them as a support for a bridge is very risky. Strike number 1. Strike number 2, these teeth have root canals in them. Root canal may seem great, hey, you're not gonna have pain, yay. But when you do a root canal, you remove the nerve, at which point you also remove the blood flow. So what happens is root canal teeth tend to dry up because there's no blood going to the tooth. They become brittle and the chances of them breaking goes up significantly. That's the second strike. The third strike for this particular patient was he doesn't have a good bite situation, right? So even though he's missing these 2 teeth, this bridge here is a complete disaster. If I may draw your attention here, this is another bridge that's failing. Guess what? 2 bridges fail out of 2. So there's separation here, there's infection here. So this patient essentially has no bite on this side, and he only has this couple teeth here and this bridge which they had installed for him. So because his bite is poor, that's strike number 3. 3 strikes and you're out. You should not do a bridge if your situation is like this. You have weak teeth, you have root canals, and you have a poor bite relationship. So what happens here, guys? If you put a bridge on weak teeth and you have a terrible bite relationship, the chance of that bridge failing is extremely high. I would give the chance of this bridge failing within 5 years about 70%, much less than 50%. So to go and spend money to put a bridge in a situation like this doesn't make a lot of sense. And guess what? You just wasted all that time, all that insurance money, and all of your money. Let's go ahead and flush that down so you don't have to flush your own money down. You. All right, guys, let's get serious. We got a lot of things to talk about. Now, before I start my thorough discussion of your 4 options in this situation, I want to go over and help those of you who don't have a dentist find a dentist. How do you do that? Well, you can go to the internet, but you're better off going to the dentist search engine known as even28.com. That's EVEN, the number 2, the number 8, like the 28 teeth in a set of healthy mouth.com. Even28 is a dentist search engine, guys. You can browse through profiles of dentists, learn more about each one, read their reviews, and when you find a great dentist, you can schedule your appointment all conveniently online and all for free from the website Even28, the dentist search engine. So guys, go find yourself a pretty good dentist to fix that smile, and let's go ahead and get our discussion started with the first option, and that is a 6-unit bridge. Okay guys, so what this patient had before his teeth broke is a 4-unit bridge. He had these 2 middle teeth missing, and the dentist had used these 2 side teeth, the lateral incisors, to anchor the bridge. So as you can see, this is the anchor, that's the first unit, this is the second unit, and going to the other side, this is the third unit, and this is the fourth anchor. So we call this a 4-unit bridge because it goes on 4 teeth and it replaces 2 missing teeth while anchoring onto 2 teeth. Now the problem with this bridge was the anchor teeth were weak and the bite was bad, so this bridge broke. So what the dentist should have done in this situation? Well, let's go out to our model here and see if we can understand it better. So if this is our model, guys, and you're missing these 2 teeth, let's put an X on it. All right, X. So if you're missing these 2 teeth, okay, you can try using the side teeth as an anchor. But the problem with that is, in this case, you had root canals, these teeth are also really weak, and the bite is bad. So the stress on these teeth is going to be tremendous, and the chances of this bridge failing is pretty high, more than 50%, in 5 years. So that's not really good prognosis. So what you can do is, instead of anchoring to 1 tooth, you can use double anchor. So what you would do is you would also attach it to the canines and the lateral, okay? So here's what happens if you go about doing that route. Okay, you can do 2 anchors here, 2 anchors here, and then now you have 2 missing front teeth, but you have 2 anchors on each side, which means 4 anchors, right? So that's a much stronger, much sturdier bridge. Plus the canine tooth, if you look at it on the model here, has a really strong root. The canine has the longest root of all the teeth on the top, and the lateral has the weakest. So you want to combine that. And if you did that, so instead of a 4-unit bridge, you made a 6-unit bridge, that bridge would have had a much better prognosis, okay? Now there's 2 ways you can do this. Oh, by the way, I actually have a model that kind of shows you. This is what a bridge would look like, okay, if you did a 6-unit bridge. And you would have anchor, anchor, gap, gap, anchor, anchor. There's a little discrepancy here. This one has the gaps here, but you can use your imagination. So this is what a 6-unit bridge would essentially look like, guys, to replace the front 2 teeth, okay? And there's 2 ways you can do this, which I went and drew on my model. So again, this is the missing 2 teeth and the 2 root canal teeth. One option would be to try to save the root canal teeth, right? So you put these posts and you build them up, and then you cut the teeth next to them, and now you got a 6-unit bridge supported by 4 teeth, 2 strong canines and 2 pretty weak laterals. But hey, you know what? You got the canines, the strong teeth, supporting the weak teeth. So as a whole, this may actually hold up. Or you can just say, you know what? I don't want to deal with these broken teeth. Let's take them out, and you can just make the 6-unit bridge on the canines. But because the canines are longer, stronger teeth, and because these teeth do not have a root canal, the chances of this lasting is much higher as opposed to just using these weak, lateral incisors. So option number 1 is a 6-unit bridge. What do I think about it? Well, I don't like it. Your bridge failed in a few years. Why would you do another one? Okay, so we're gonna give this 6-unit bridge a 2 or a 3, depending on where you decide, whether or not you decide to keep those 2 teeth. But I'm just not digging it. And I wasn't even gonna give this patient this option because his first bridge failed in 4 years. You know what he's gonna tell me if I say, hey, let's do another bridge and cut 2 more teeth? How do I know those teeth aren't gonna fail and now I have 6 missing teeth, right? So initially you could have just done an implant or a denture and avoided all this. Now, because of the bridge, the patient lost 2 teeth. So do we want to risk losing 2 more teeth? No. So I don't have the courage to tell the patient this option because I know the chances of that failing in 5 years is extremely high, 80%. Even though we're doing it the correct way and going to use the supporting canine. But it's just not a good option, and there's better options out there. So we don't like this option, which means we can go ahead and check it out, right? So if you had a bridge and it failed, a short bridge, and now you want to do a long bridge to replace it, and it's only been a couple years, how do you know this longer bridge isn't going to fail? It probably is. So that's going to be a waste of money. I don't think the patient should do that, and we're going to go ahead and flush this money down because it's just too risky to put another bridge knowing that the first bridge failed, and this one can also fail. Okay guys, not a good option. Let's go ahead and see what else we can do other than a bridge. Okay guys, the second option is to go with a partial denture. Now, of course, we can do metal or flexible, which we're not gonna get into this video. I have another video that explains the difference, but you can make a partial dentures. What are partial dentures? Partial dentures are things like this. They're removable. They go in to replace your missing teeth, and they come out. Now, a lot of people might look at this and say, wait a second, you want me to get a partial denture over a bridge that's permanent, right? Okay, that sounds legitimate if you haven't looked at all the scenarios, guys, but you gotta understand, if you're gonna go with a bridge, your teeth need to be strong enough. You need to have a proper bite, and a lot of check marks need to be applied, okay? If you're just gonna nilly-willy put a bridge on a bunch of teeth where there's a whole bunch of problems, it's gonna break. So are you better off with a partial denture in this case? If they had made this patient a partial denture with 2 front teeth instead of a bridge that has a really high chance of failing, the patient would have had his or her denture, and those teeth would have been there for a very long time. The stress of the bridge is what it broke it. So a lot of times, if it's going to be a shoddy bridge and it's not going to meet the requirements of a long-term prosthesis in your mouth, why waste money? This thing costs more than this, and this only addresses your front few teeth, whereas this patient has a big old infection here, right? I mean, this bridge is also failing. So what you want to do if you go with a partial denture route is you want to not only replace these teeth, but you want to take this bridge out and do something about that too, right? Because now by taking this bridge out, you get rid of the infection, and you can start chewing on this side and you can replace your teeth. Yes, it's going to be a big partial denture. You're going to have 7-8 teeth replaced. But guys, do you want an infection in your mouth? Do you want a bridge that's going to fail in a few years? You don't. So if you don't have the finances to do something permanent, do yourself a favor and just get a nice partial denture, start wearing it, get rid of the infection, stabilize your bite, and then in due time, money comes in. Okay, great, go do dental implant. But you're much better off going with a partial denture that's gonna last than a bridge that isn't gonna last, right? So how do we go down the partial denture route? Well, because the patient has a massive infection here, I would suggest including this in the partial denture design. So I wouldn't just replace the front 4 teeth, that's a little bit silly, or the front 2 teeth if they had done this prior to doing this. I would also include this area. And the way it would look like is like this, guys, okay? So we would keep the canine here. We have the front 4 teeth missing, right? We'll take out these broken root tips. No point of spending money on teeth that are not with a good high prognosis. And then we would keep these other 3 teeth on the side. So if we do something like that, we're going to have an anchor on this tooth, right? Tooth number 6. We're going to have an anchor on this tooth number 11, and then 12, 13. We're going to have an anchor on tooth number 14. So this is actually going to have 3 anchor points. Okay, I'm going to show you guys the bird's eye view of this. So again, we're anchoring the canines, which are really good teeth to anchor, and the molar. Okay, so if you go with a partial denture design like this, whether it's metal or flexible, you're actually going to get your smile back, and you're going to be able to chew on the side where the bridge is failing. So you're going to improve your bite, and you're going to get your look back. Not a bad option. And again, of course, partial dentures are not as good as implant. There's no question about that. But you can address this problem and your back teeth all with one stone, right? 2 birds with 1 stone. Your smile and your chewing can be addressed with 1 partial denture. Whereas if you're going to go the dental implant route, you're going to have to address this and this. You know, the cost and the headaches becomes astronomical. So a partial denture is a very good option, guys. And again, as always, we can go with 1 of 2 partial dentures if I can find them. You can do the metal base, right, which has the metal cast, or you can do the flexible, which kind of bends and has pin clips. So again, I have a video that describes the difference between those, but regardless of which option you go with, a partial denture is a good option. Okay, I give a flexible partial denture a 6 and a metal partial denture a 7 in this scenario. The reason the metal gets a slight advantage is because we just don't know if these teeth are going to break, especially these 3 teeth have, you know, so-so prognosis. So with a metal, we can always add them and not get a new denture. Whereas with a flexible, if one of these breaks, you may have to just get a brand new denture, and then the cost and the headache becomes a lot more. So because the teeth are kind of so-so prognosis, I would recommend a metal over a flexible partial denture. Regardless, a flexible partial denture, metal partial denture, they're pretty good options because you can stabilize your bite and you can get your smile back, and you're not stressing out other teeth, risking losing teeth in your mouth. Okay guys, the third option that our patient has is to start going the implant route. He hasn't had any implants now. Well, guess what? If you're gonna live long enough, you need implants, or you're gonna have missing teeth and your bite collapses. So implants are fantastic, and at some point we all need to start going the implant route. You know, you might have been with your dentist for a long time, they don't do implants, but when you start to reach these points where your bite is start getting thrown off and your crowns and root canals are failing, it's time to give implants a chance because you're not gonna regret it. So here's what happens. Again, just a quick preview. You have this failing bridge and you have broken root tips here. So how would you go about doing dental implants? Well, you know, obviously you need to do something for this bridge, but that's on the back burner. Right now the patient wants to smile. He knows he has an infection and the bridge is problematic, but he just wants to get his smile fixed. So let's just talk about this, and we can, you know, briefly touch about on the back one at the end. Okay, so how do you replace this teeth, right? You got these 2 teeth, number 8 and 9, and then number 7 and 10 are broken. So you got 4 teeth. What do? Do you put 4 implants and 4 crowns? The problem is A, cost, and B, more importantly, the jawbone. There's usually not that much jawbone to just stick in 4 screws for missing 4 teeth. So in a case like this, you're much better off doing a 4-unit implant bridge on 2 implants. And that's what this would look like. Let me give you my illustration here. So we would put 2 implants here, and we would make a 4-unit bridge that sits on top of it, right? So the bridge is gonna sit on top of 2 implants. Do I have a model that describes it? Sort of, kind of. You know, if you can see, this is a 3-unit implant bridge, right? You have 2 implants, and the bridge sits on top of it. So you would do the same thing here. 1 implant here, 1 here, and you would make a 4-unit bridge on top of it. That's what an implant bridge is. It's a bridge that uses implants instead of teeth as an anchor point. And that would give the best solution for your smile. Okay, and guys, I'm not gonna get too technical here, but heck, I start talking, and once I start talking, you cannot stop me. You can do this a couple different ways, right? Where do you put these implants, right? You got the 4 missing teeth, 7, 8, 9, and 10. Where are you gonna put the implants? Does it matter? Honestly, this sounds kind of weird. It does not matter. You can put the implants on the corners. That's what you would kind of assume the best way is, right? Put them on the sides and make a 4-unit implant bridge. Fantastic. But you can do it any other way. You can stagger them and put them in position 8 and 10. You can put them in position 7 and 9. Or if you have no jawbone here, just put them right in the middle. It does not matter. If you put big, large, strong implants, as long as you get the screws in the jawbone, we can make the 4-unit bridge regardless. As long as the implants are placed relatively in the position of any of the 4 original teeth, this will work. And all of these have pretty much the same prognosis. Now, of course, this is the best design. This is the least desirable design. But I'm telling you, they all work. So when I do this surgery, I tell the patient, look, I'm trying to put 2 implants in this gap where you have 4 teeth. And I don't know where I'm going to put them. As long as I put one on the right side, one on the left side, I'm good. Because I can make my bridge. Now, will it get a little bit more complicated? Will my lab bill go up? Yeah, probably it will. But as far as actually using the implants to design it, because implants are solid, strong titanium, there's no decays, they don't get fragile like natural teeth, they're much stronger than your own roots, especially a root of a 67-year-old guy like this patient, right? So when you're dealing with implants, they're strong enough to support your 4-unit bridge. You don't need to really worry about where the implants go. As long as your dentist knows what they're doing and they place the implants properly in solid bone, you should be good. And even though this is the best design, this is the worst design, they all work. So just get the implants there, get your 4-unit bridge, and you'll be in good shape. Okay, so that's how the implant bridge would work. But the problem with the implant bridge is that only takes care of the front. You still have this terrible, failing, infected bridge here, at which point you have to, cross the path and do a couple implants there. So if you're gonna go the implant route for the front, you have to know in the back of your head that at some point you have to cross the bridge, no pun intended, and address the failing bridge on this side. Okay, so if you're okay with that, then an implant is a fantastic option. Let's go to our grade card here. And what I'm gonna do is I'm gonna give the dental implant a score of 8. And the only reason, honestly, it doesn't get a 9 or a 10 is because in this case, the dental implant bridge only addresses here, and you still have the failing bridge here. So you might have to go and address that at some point. But once you do that, this grade can actually go up to a 9 or maybe even a 10. But yeah, a dental implant is a fantastic option. You're not risking damaging your other teeth. And it's a very good option that's probably gonna outlive our patient. And that's why it gets a 8. Okay guys, we're about done with this, so just bear with me. Option number 4 is All-on-4. See what I did? Option 4, All-on-4. All-on-4 is gonna come around a lot, and we're gonna discuss it because it's very popular and it's a very good option in some scenarios. Is it a good option in this case? Well, let's go ahead and take a look. So patient has 2 broken root tips. He's got 4 good teeth here, 1 here. So 5 total viable teeth and this failing bridge here. Is he a good candidate for All-on-4? Well, first off, let me show you what an All-on-4 would look like, and then we can discuss if it's a good option or not. In order to do an All-on-4, the patient needs to remove all of his teeth, okay? So even though he has 5 good teeth left, they need to come out. You cannot keep any teeth if you're gonna do All-on-4, okay? So what's gonna happen is for All-on-4, we're gonna have to take all of the teeth out and stick in 4 implants in this area where the highest quality bone is and make a fake prosthesis on top. Let me show this to you on a model. So if the patient decides to do All-on-4, we're gonna take all of his or her teeth out, put in 4 implants, and then make our prosthesis here from porcelain or ceramic. And when it's all said and done, we're gonna screw it in as such. And yay, you got all your teeth supported by 4 implants or maybe more, and you don't have to worry about cavities or failing teeth. So is this patient a good candidate for this? Well, he needs something here. Probably the best option is implant. He needs something here. Probably the best option is implant. And what happens is when you start working here, I don't know if you can see this sinus here, but there's not a lot of jawbone here. So the sweet thing about All-on-4 is because there's an infection in the sinus and tons of bone loss, if you like to go for the All-on-4 treatment like this, we do not use this infected sinus bone, okay? We just kind of use it's a shortcut technique. We put the implants here. Yeah, I mean, we're gonna have teeth here, yeah, but that's gonna be supported by a cantilever here, right, with this prosthesis. We're actually gonna put implants right here because the sinus is always very hard to work with. And in this particular case, we got a massive infection going on with the sinuses too, right? There you go, that's the one, yeah, massive infection, bone loss and stuff. So the advantage of going with the All-on-4 is you don't have to do sinus lift, sinus graft, wait for that to heal. Spend 1 year, maybe 6 months on your front teeth, then another year here. You can do it all at the same time. And the question is, will these 3-4 teeth fail in a few years? You betcha it probably will fail. So an All-on-4 is a fantastic option for this patient if he's willing to go through the headaches and the cost, of course, okay? Because if he does the implant route, which was a really good option, the previous option number 3, he still has to go on round 2, address this failing bridge in a year or 2. Now, of course, when you do this, you pay less and you can kind of pay over time. With All-on-4, you're just taking care of it all at once. Okay, so if you're ready to do that, You want to spend a year and just pull out your teeth and just not have to worry about more dental visits, more appointments, then yeah, All-on-4 is a fantastic option for this patient. I mean, heck, we replace his missing front 4 teeth, we get rid of this failing bridge, and yes, while these crowns haven't failed yet, they have root canals, they have crowns, they're not really nice virgin teeth. So you're basically only sacrificing the 2K now. And All-on-4 is pretty much the best option for this patient, which is why we're gonna give it a really good grade. A 9. Yeah, I'm not gonna go over a 9, so this is pretty much as good as it gets. So yeah, going with an All-on-4 in a scenario like this where you have problems with 2/3 of your mouth is really a good option, because obviously if you have problems with all 3 sides, an All-on-4 is a must. If you have problems with only 1/3 of your mouth, like the front or the back, All-on-4 is a bit of an overkill. But when you got problems with 2/3 of the mouth, then an All-on-4 is a really good preemptive option, because you know you're gonna end up with problems here. I mean, you lost this bridge, you lost this bridge. What makes you think you're gonna keep the last bridge for more than another year or two? And an All-on-4 addresses all of that during one long treatment. As long as you have a year to pull your teeth, do the implants, let all of that heal, do the surgeries, and get your permanent teeth fixed in your mouth, like this. Okay guys, it's time for me to share my final thoughts. Okay, that was intense. I have other videos that explains everything I yacked about, so go check them out. But yeah, let me just give a quick rundown of everything we talked about. You have a bridge like this, which is not a good bridge because it's not a strong bridge. You have root canal teeth, you have weak roots, and you have a poor bite. Chances of this bridge failing is high, and sure enough, it fails. So here's the first problem with that, right? This is what you end up with. Broken tooth and broken tooth. Okay, first of all, how do you know if your tooth broke or if the bridge just fell out, right? Because that's the first thing I told the patient. Well, here's what you do. Grab your bridge, if it comes out of your mouth, guys, and look at it. Do you see a nice hole like this? If it did, then yeah, the bridge just fell out. Go there, they'll clean it, glue it back in, charge you 100, 200 bucks, you're good to go. But if the bridge comes out and your tooth is broken in here, if you see white stuff in here, your tooth's broken in there. And if you see white stuff in all of this, all of your teeth broke, which is what happened to this patient, okay? So there's a big difference between a bridge just falling out, which means clean it, glue it back in, or a bridge breaking your teeth inside of them and destroying your teeth, which is what happened to our patient in this particular scenario, okay? So that's the first thing, okay? And you know what, in this case, the patient was unlucky. It wasn't a loose bridge that fell out. It was a bridge that broke the teeth. Okay, and then the next discussion was, what options do we have? And we went through everything. You can redo the bridge, but that's not a good option. You can go through the partial dentures, which was a good option, or you can start doing implants, which is a good option. So it's kind of weird because I rank partial dentures better than bridges. And that's what happens. If your bridge doesn't have a good chance of lasting for, 10, 15 years, why would you want to spend all this time and money on it? Why? I mean, do you like wasting money? If you do, just donate it to a charity. Why waste it on dental work? If you're going to do dental work, guys, you need to make sure that the prognosis is good. If you're going to put a bridge on your teeth, you need to kind of have an idea if that bridge is going to last 5 years. Does it have an 80, 90% chance of lasting 5 years? That's a question you need to ask. There's never 100%. I mean, I'd be lying to you. Even implants can fail, right? But if you're going to spend all this time and money, you want something that has a really good prognosis, 80, 90%. So when I get a bridge like this that has 3 strikes, weak lateral incisors, a root canal teeth, and a poor bite. When you get a bridge that has 3 strikes, and the prognosis is far less than 50%, it's a bit of an insanity to spend money on it. I mean, this was a gorgeous bridge, and I feel for the patient. I also feel for the doctor, because, the doctors don't do this knowing it's going to fail. They just don't pay attention. Maybe they should watch my videos, right? But yeah, putting a bridge is only a good option if you have a strong bite and your supporting teeth are strong. If you don't have those criteria, go with the dentures. It might hurt your ego that you have something removable, but look at the scenario. You started with 2 missing teeth. Now you have 4 missing teeth. Can that end up being 6 missing teeth? Of course it can. I had a patient who was 40 years old and he had lost all of his teeth because of this story, because he started with a bridge, that failed. They made the bridge 2 teeth bigger. That failed. They added 2 teeth on each side, 8 teeth, that failed, and boom, you're gone, you're toothless. So you don't want to do something where the prognosis is poor, which begs the question, Whoa, a lot of people who do this do it because their insurance approves them. Well, should you do anything that the insurance approves because they're paying a part or all of it? Of course you shouldn't. Your teeth, these guys, they don't know what insurance is. They don't know what dollar bills is. They just understand how much forces is being exerted onto them. So if you're gonna overstress them with a poor prosthesis design like this was, you're gonna break your bridges, and the bridges aren't gonna, your teeth aren't gonna say, wait a second, our insurance covered us, so we should last and we should make it work. No, it doesn't work like that. Okay, so your first question, like 90% of the population, if you've been watching my videos, when you're presented with this, shouldn't be, how much do I pay? Okay, fine. I mean, you know, a bridge like this, first of all, a bridge like this still costs thousands of dollars, right? The two root canals, beautiful root canals, beautiful posts, very high quality work, might I say. But it was a poor design. Yeah, it wasn't. There was a lot of stress factors, a lot of mechanical issues with this bridge. But a bridge like this, even with insurance, costs $1,000. I mean, two root canal, 4-unit bridge on average in the United States is about $6,000, whereas doing 2 implants would be maybe $8,000. So was it worth spending the extra $2,000 so you don't have to lose your bridge, and now you need 2 additional implants? Yes, it's worth it, guys. Go with what's the best prognosis and what makes the best sense. And sometimes a denture is going to be your best option, guys. Sometimes it makes more sense to do a denture now, get your bite stabilized, get rid of the infections, and then in a couple years, save up the money, do the implants. Fine. You don't have to push yourself to do the implants if you can't afford it. Sometimes just getting that denture and stabilizing the situation is a good option to go, okay? But don't do something that's going to be harmful to your mouth. Now, guys, if you're still confused and you don't know what to do, you can watch the video all over again, or you can send me your x-rays and I can give you a complimentary second opinion. This is for fun, but this is not anything medically diagnosis. But yeah, go to the website tpmymouth.com. That's TP for treatment plan, mymouth.com, and you can send your x-rays and we can have a discussion, or you can put your x-rays and your questions in the comments below and I'll be more than glad to share it with you guys. Yeah, but guys, you gotta be your own advocate. You know, a dentist is kind of like a car mechanic. Nobody knows what that car mechanic is doing under that hood, right? I mean, $3,000 bill, you need A, B, and C done. Okay, well, if you know about cars, then you can be your own advocate and you can make sure that the mechanic is doing a good job. Okay, if you want to be your own advocate and if you want the dentist to do the right thing for your mouth, the first step is to be your own advocate, and that's for you to understand your options. Now, do I have time to sit down and do this presentation to my patients? No, I would be bankrupt if I was to spend 30 minutes explaining this to patients. And you don't want to give patients 6, 7 options because they're never gonna make up their mind. So what I want you guys to do is watch this video and come up for yourself on which option makes the most sense to you. And I have other treatment plan videos which you can check out to learn more about different scenarios. Okay, but you need to be your own advocate. And the more you know about what's going on in your mouth, the better a decision you can make. Because you don't want to make a decision on something that's gonna last 3, 4 years. We're not planning on lasting 3, 4 years. We're not a car. You know, if they give you a car, and you know, Californians, where I'm at, we all lease our car for 3 years. So I don't care what happens to that car after 3 years. It can blow up and catch fire as far as I'm concerned, right? I'll be leasing another car, right? These damn Californians. But your mouth is not a car, guys. You can't lease your mouth for 3 years. Please stop treating your mouth like a leased car. Get it something that's gonna last for 20 years. And if the cost is a little bit higher, then just spend the extra bucks. Oh, and by the way, what did we do for this patient? We ended up putting 2 implants in his mouth. We took out the teeth, we stuck in 2 implants, and we're gonna make a 4-unit bridge. He knows he needs to replace this. Yes, an All-on-4 was a better option, but the patient wasn't ready to spend the big bucks, and he travels a lot, so he wanted to do something to get his smile back, and he'll cross that bridge. He'll do it in 2 years. They always come back. And this is what the x-rays look like. This is the CBCT, and you can see the bone. This is the buccal plate, lingual plate, and this is the nostril cavity. Beautiful, solid implant. Yeah, that's the second one. I don't know why all of his x-rays look identical. But yeah, we ended up putting 2 implants in the position teeth number 7 and 10, and we're gonna make a 4-unit bridge on top for the patient. Guys, I hope you enjoyed the video. Be sure to subscribe. Sorry, that video is a little bit long. I'll see you guys next time.